Hey tubers, what's going on? It's me, Kay. I just wanted to make a video because I was thinking to myself earlier about the different types of surgeries available, and what brought that on was because I was looking on Thinner Times forum. For the most part, I go to thinnertimesforums.com and verticalsleevetalk.com. There's others, there's Obesity Help, but for whatever reason, I just don't like the structure of that site. It just seems really, when I say busy, I don't mean like a lot of people, like, active. It's kind of jumbled up to me. Something about it just turns me off. I like Vertical Sleeve Talk because of its structure. Thinner Times has the same structure now, I noticed. Like, they're using the same, I guess the same person who's, like, doing it, they're doing it the same. So it's just cleaner, it's nicer, to me it's more organized. So, I was looking at, like, weight loss pictures and, people with the gastric bypass, at the beginning they lose more weight faster. So, it made me start thinking, I mean, of course, the reason I chose the vertical sleeve is because there's no rerouting of the intestines and pretty much everything stays the same. And at the same time, before, I was thinking of the duodenal switch. And, because somebody suggested that. But I'm like, to me, it's still a gastric bypass. So, because, I mean, if you don't know, a duodenal switch is the lap band, the vertical sleeve and the gastric bypass combined. So you lose weight more than any gastric bypass person in sleeve because you get the malabsorption as well as the reduction of the stomach. So I was thinking to myself today, like, maybe. But the doctor I'm going to, he doesn't perform the duodenal switch. It's only the three choices: the lap band, the sleeve, and the bypass. So I thought to myself, how bad is it really if I get the bypass? And I was just saying, like, you know what, like, the whole idea is, like I said, I didn't have to take as much vitamins. Like, once you're on the bypass, it's vitamins all the time. And I think reading something about, I forgot what it's called, but you can not really have fainting spells, but something to do with the bypass. And that's kind of, I think, that what made me go like, oh, whoa. So I'm thinking about it now, because I completely forgot about that. But I'm just kind of like, I think it's hypo or hyperglycemia. So that's what was like, oh my gosh, And it's one of those things you don't know what happens until you do it, Same thing with the vertical sleeve. I just finished eating. I had, I'm still on the protein, so I had like my soy meats, and I had one potato. Like, I limit myself to one potato per, like, every time I eat. For the most part, like, I've been doing really well, but before I used to eat like 2 or 3 potatoes. So every time I eat, not every time, but I just try to limit myself to only one. Like, if I do have a carb, which is usually, I've been getting the Thomas English muffins as opposed to regular bread. And here's why. One muffin is between 100 and 130 calories. The average bread slice is 90 to 120 calories. And usually if I'm making a sandwich, I don't make sandwiches anymore because I don't eat meat. And, I mean, there are, like, soy slices and stuff. But most of the time, I would use 2 pieces of bread if I'm eating it with something. To me, with the Thomas English muffin, it's appearing to be more volume. And it looks like, to me, like, a Thomas English muffin, I would think is like 2 bread slices, if you know what I'm trying to say. But the calorie-wise, it comes down to only 1 bread slice. There are bread slices, I forgot the name of it, which has like 70, but it's smaller. 70 calories per slice, but it's smaller. But to me, although I might not necessarily be saving, because you get, I think, 6 I've been getting them 2 for $3 or 2 for $5. I'm not saving traditional way at the grocery store. I'm sure if I went to Costco or something, I can get that in bulk. But I am saving for my mind and my calorie content, you know. Because I know I'm one of those people where anything that's going to trick my mind into thinking I'm getting more is a plus. For example, like I can go to Costco because I'm not one of those people, if I get a large amount of something, that I'll save it like you should. Oh, okay, I got a large bag of chips. All right, I'm going to save it for the whole week. No, it's going to be gone in 1 or 2 days. So what I would do is, if I feel the need that I need to have some chips, I'll just buy it for that day. Like, I'll buy like a bag or two of the 25-cent chips, and that's it. I'm not going to have anything extra sitting in my house. So that works for me. Same thing with chocolate. It's just best to not be in my house. And if it's in my house, I get the amount for that feeling. I can't just save it around. So I would suggest any people who are similar to me in their eating habits, buy smaller. Even if you're not saving, you're gonna save. If you're not saving in the pockets, you're saving on the pounds. So anyway, I digress. So I go back to so yeah, I was just thinking, maybe the duodenal switch, because I mean, of course, you're going to be excited at the fact that you're going to be losing the most weight sooner. But so my question to the VSGers that watch this channel, like, or even the non-VSGers, just bariatric patients, period, like, did you ever think of the duodenal switch, or did you ever think, like, granted, did you ever not really change your mind, you definitely know you want to have bariatric surgery, but did you, like, flip-flop between which, like, surgery? Of course, I know some people's going to say, you know, they originally wanted the lap band because, you know, anything that sounds permanent to the body is kind of scary. But, so I know that I'm going to hear, you know, from you about that. And I've even thought about it, too, like, you know, because there are success stories and stuff like that. But for me, I just I'm not feeling like constantly having to go for a fill. Even though when you think about it, it probably wouldn't be that much of an issue. But to me, I'm like, if I'm going to go for a surgery, I want it to be a little bit more effective weight loss wise than the band. And so, you know, the vertical sleeve kind of fits right into the middle between the band and the bypass. So if my doctor did the duodenal switch, would I want to do it? You know what? I would probably be thinking about it, like, because, you know, like, I have a quest to just be really, really small, because to me, this is like a tool. I know it's a tool. I know it's not going to be like that. But it's just like, if I'm going to be skinny, let me be the kind of skinny that I want to be. Like, something I've never, ever, you know, fathomed that I would be. Because I'm the kind of person, like, if I weren't allowed to have the surgery for whatever reason, I'd be comfortable at being a size 12. Because I know that I can still get into, like, junior sizes, and I won't be shopping at the plus size store anymore. So once I'm able to not do that, then I'm fine. And I can honestly say that I can do that at 180 pounds. Because at 192, I can fit into some, like, extra large, like, clothes, but it wasn't the way I'd wear it. Of course, I've seen women wear it just, like, that way. So, so yeah, I'm gonna see if I can try to go onto a liquid diet this Friday. I'm not sure if I'm gonna go to my PCP tomorrow because it's supposed to be snowing, but I don't really know. If it's not that bad, I'll still go. And that's basically it. So, I do feel lighter, but who knows? I haven't weighed myself. I'm trying not to be a scale Nazi. And, I still want to do a cleanser, so I'll probably wait until after Thursday to, do that cleanser. But today, I didn't really eat too much, so it was a really good thing. I had for breakfast 1 packet of oatmeal and some yogurt, and then, which was at like 10 something, and just now, I had maybe in a really small foam bowl, my soy meats, and, actually, you know, I had 3, what you call those things? Quaker Oats chewy granola bars. One of them was low fat, low calorie, whatever, and 2 was regular, so that's 280 something. So I guess it was equivalent to like a chocolate bar, but I'm pretty much good in that department. So I'll talk to you guys later. I think I'm gonna make a part 2 because I'm reaching 10 minutes. I'll talk to you. Stay tuned.